And welcome back to Game On, Lexington Community Stadium. Game 2 of 4-game set between Hawaii and the Sooners of the University of Oklahoma. But now we're going to take a break and talk with Dr. Edward Weldon III from Straub. Timeout for Health brought to you by Straub. We're going to talk about elbow and shoulder injuries because that seems to be one of the big subjects in baseball. And the number one thing we hear more and more now, and it's almost commonplace, is Tommy John surgery. But I don't think a lot of people really understand what is Tommy John surgery.
Well, Tommy John surgery is a surgery for the elbow, specifically for pitchers and people that stress their elbow with throwing and other activities, where they have had an injury to the ligament on the inside of the elbow, and they are no longer able to throw at their high velocity that they were used to throwing. And when the ligament gets stretched out, it doesn't go back to normal on its own. So they come to a surgeon, and the surgeon weaves a new ligament where the old ligament was, and then they have to heal that. Now, it's a very good procedure, but takes a long time to heal, and it's up to a year before they're throwing at maximum velocity again, and there's no guarantee that it works.
You know, I've heard that it even takes up to 18 to 24 months to be 100% healed after Tommy John surgery.
And that's right, it can. It can, and sometimes it has to be redone.
Well, Hawaii has had a number of guys, and I mentioned in the major leagues, you see a number of guys. Another injury that recently has kind of shown up is the labrum injury. Jordan Richards of Hawaii, he's an outfielder, had a labrum surgery. Yes. And then, of course, Arakawa had the labrum surgery as well.
That's right. I think he had a slap tear, which is the superior labrum on the top of the shoulder. And there are essentially three types of labral tears. There's the slap tear, which is the labral tear on the top of the shoulder. There is the anterior or front labral tear and the back labral tear. And they all are different, but they are treated the same way. Now, the traditional way of treating those is with surgery, and arthroscopic surgery for those is very, very effective. Recently, out of Seattle, there's been a new program called the Jackins program, and it's geared for labral tears of all three types. And it is a non-operative method of treating them. And it doesn't work on everybody, but for the athlete that's in season and would like to remain continuing to play their game, or for the person who's working and would like not to have to take off work, it's a good first step.
What about preventive measures to make sure, I don't know if you can make sure anymore, but maybe try to alleviate of getting Tommy John or labrum injury like that?
Well, that's an excellent point. And you know, the most important thing about the shoulder is to keep it loose. When you start to feel pain in your shoulder, whether it's from a labral tear or a partial thickness rotator cuff tear or one of a dozen things, the most important thing is to make sure you regain your flexibility. If your flexibility on the painful side is less than the other side, that's an indicator that you have to stretch. And most of the time, when you finally stretch it out, the pain goes away and your function returns, even though the tear is still there.
I have a question, Doc, and you hear about Tommy Johns happening so much more often, and so it's so much more prevalent now in upper echelons of baseball. Why do you think that?
I think that Tommy John is, I'm not sure this is on, but Tommy John is a procedure that's been shown to work in Tommy John. And many pitchers have had it, and they have a devastating injury that before the Tommy John surgery was invented, they were done. And then Tommy John had the surgery, and he came back and pitched many, many productive seasons. And this goes on in college, in high school, and so it's a wonderful surgery. Now, it's a wonderful surgery that doesn't have a 100% success rate, and so it shouldn't be done willy-nilly, and it shouldn't be done on people who haven't had symptoms.
Right. And my second question is that, you know, a lot of times people say that, oh, they expect to throw harder after Tommy John surgery. Is that true or is that not?
Well, it's both true and not true. And it's true in the sense that the reason they came to see the doctor because they're losing velocity. They went from throwing 90 to 89 down, now they're in the 80s and low 80s. It's because their medial collateral ligament has been disrupted. And so when they have the surgery, they get to pitch harder again, back to the way they were or even better. Now, if you take a pitcher that has no medial collateral ligament injury and they have no problem in that area, doing the Tommy John is not necessarily going to help them.
Are you seeing the patients get younger and younger now with shoulder and elbow problems because of playing sports?
Oh, that is absolutely true. Yes, and again, it's a tragedy when you see a young person aspiring to go to college and play a sport and have an injury, and you really want to help them, and it's a very difficult thing. Now, like I said, fortunately these days, what we've recently implemented is this Jackins procedure out of Seattle, Jackins protocol out of Seattle for stretching and helping these things, and we've had at Straub fantastic results with helping people avoid surgery and continue their season at the high level they were playing that got them the accolades they first got.
What's the best exercise to use, or stretching, things like that?
Yeah, you know, while it's true that strengthening is important, stretching, as I was saying, is the most important aspect of the shoulder. Now, for the elbow, strengthening is more important. Strengthening of the wrist and the hand and the flexion and extension is the most important. But for the shoulder, it's all about range of motion. If you're having pain in your shoulder, check your range of motion in all directions. And if it's different and or painful, you got to get it loose.
Well, Harry's had a number of shoulder and elbow surgery. What are all the surgeries you had?
I had a double procedure called a slap tear, like we were talking about earlier,
Yes.
and a Bankart repair because I was a chronic dislocator of my shoulder. So
Yes. Now, that's an excellent point. If you have a labral tear and it is big enough that the shoulder is actually unstable and dislocating, and you know what that was like, very unpleasant, your only choice is to do a surgery to provide permanent stability. But you can do some therapy to get you through a season, to get it stable enough so you can continue to play.
Well, for Harry, the problem was that he just threw too hard for his body size. I mean, the guy threw like 95 and he's 5'6", so that was probably the main problem there.
I mean, I would like to say that, but I would say this, that when I did get hurt, that was the last time I did throw 95,
Yeah.
so.
Right, and that's often the case.
Well, Doc, thank you so much for joining us and talking about shoulder and elbow injuries and preventive ways to hopefully help folks from getting injured.
Well, I appreciate being here. Thank
All
you,
right,
guys.
Thank you.